So good morning all. Today we will discuss mnemonics to remember psychiatric emergencies. So psychiatric emergency is an emergency situation which need immediate attention that is associated with a client's disturbed memory, disturbed thought, disturbed perception, disturbed cognition, and if it is left untreated, he can endanger his own life and it can affect problem with the others' life and property. So you need immediate attention and management. So when you analyze the number of reasons for this, there is n number. This mnemonic, what I am right now explaining, will help you to remember psychiatric emergencies. That is 4 Ds. First D indicates it is disease based reasons, specifically psychiatric disease specific reasons. It includes major depression, bipolar affective disorder, current episode of depression, schizophrenia, alcohol use disorders or substance abuse disorder in general, borderline personality disorder, eating disorders, and even sexual disorders. Many people, I could see a few patients who committed or attempted suicide because of these sexual disorders. So that is all about first D, that is disease specific disorders. Next one is drug based reasons. First one is disease based reasons or etiological factors. Second one is drug based etiological factors. In that we can see first one is serotonin syndrome. As you know, major psychiatric disorders are associated with a change in neurotransmitters, mainly serotonin, dopamine and norepinephrine. And there are various situations where the amount of serotonin can increase rapidly in a patient. Such condition is a psychiatric emergency where you need to deal in an abrupt way, or you need to deal that situation in a speedy manner. Otherwise, patient's life can be in danger, or those who are caring that patient's life can be in danger, or even it can affect badly regarding that environmental problems can also, that is environmental restrictions can also happen in such situations. So that is very important. There are various drugs that can result in this serotonin syndrome. SSRIs, SNRIs, MAOI, tricyclic antidepressants. So those patients who are consuming taking this medication can leads to serotonin syndrome, abnormal elevation of serotonin that may have problem. And in order to identify this serotonin syndrome, there are 3 A's. First A is activity increase, that is hyperreflexia, tremors, activity related reasons. Then autonomic instability, so it will affect the autonomic system and will have autonomic side effects. Then of course next one is altered mental status. So when you suspect a person with serotonin syndrome, you need to think about the 3 A's. First A is increased activity or tremors, hyperactivity, hyperreflexia, etc. Autonomic instability, second A, and third one is altered instability or altered mental status. So such patients can be seen as patient is in psychiatric emergency. The treatment choice for such condition is cyproheptadine, which will decrease 5-HT, serotonin receptor antagonist. So definitely the amount of serotonin can come down and patient will get relief from that emergency situation. The second important drug-related reason for psychiatric emergency is hypertensive crisis. This is mainly seen when the patient is consuming this monoamine oxidase inhibitors, and when the person is on monoamine oxidase inhibitor and he consumes this tyramine containing food items, patient can develop hypertensive crisis, severe elevation of blood pressure, and blood pressure usually systolic pressure more than 180 and diastolic pressure more than 120. Such situation is known as hypertensive crisis. It is a psychiatric emergency. Treatment of choice is phenethylamine. Phenethylamine is the drug that we can administer. Of course, stoppage of medication, then phenethylamine can be administered for such patients. Major complication associated with this one is retinal detachment. The patient may complain of visual problems because there is possibility of retinal detachment. Next psychiatric emergency, drug-related psychiatric emergency is NMS, neuroleptic malignant syndrome. That's as you know, it is termed as one of the EPS, extrapyramidal symptom, where the person may have myoglobinuria, then encephalopathy can be there, increased vital signs, increased creatine kinase, and of course lead pipe syndrome, muscle rigidity can also happen. The drug of choice for that situation is stoppage of medication, and of course it is bromocriptine. Next drug-related reason for, or drug-induced drug-related reason for psychiatric emergency or psychiatric emergency resulting from this drug-based is acute dystonia. It's another EPS, extrapyramidal symptom. It is by the blocking of D2 receptors of the nigrostriatal pathway. The symptoms are acute, whereas in akathisia or drug-induced Parkinsonism or tardive dyskinesia, the progression of that symptoms are very slow. Compared to this acute dystonia, the symptoms may come abruptly. So that is another important drug-induced psychiatric emergency or drug-based psychiatric emergency. Next one is lithium toxicity. As you know, lithium is a drug of choice for BPAD, manic episode, and the patients may come with tremors in the upper extremity, hyperthyroidism, nephrogenic diabetic insipidus, cardiac abnormalities like QT prolongation, or arrhythmias can be seen. Such situation is another drug-induced psychiatric emergency. Next one is tricyclic antidepressant toxicity. It is because of the toxic effect of tricyclic antidepressant what we take. Here the person can come with convulsions, coma, and cardiac toxicity. QT prolongation can be seen in such patients. It's a psychiatric emergency. In such condition also we can provide supportive care and symptomatic management and stoppage of that particular medication. So that's all about second D, that is drug-induced psychiatric emergency. Next D is decision-based psychiatric emergency. Decision to whether to go with life what is available for that individual or to end up their life, that is suicide. There are various reasons for suicide. Suicide is a psychiatric emergency. Different theories explains about suicide, and there are three important types of suicide according to psychosocial theory put forwarded by Durkheim's. That is egoistic suicide, anomic suicide, and altruistic suicide. Egoistic suicide is nothing but the person commits suicide because the person's integrity with the social system is broken. As a result, he may not be able to live normally in that society, and he will show withdrawn behavior and finally can commit suicide. Anomic suicide is associated with social crisis or political crisis. The person may not be able to live in that society because of the social crisis, because of the political crisis. If suicide is based on that reasons, it can be termed as anomic suicide. Then altruistic suicide. Altruistic suicide is nothing but it is for the benefit. The person is sacrificing his or life for the benefit of others, especially society. So for the societal reasons, he is sacrificing his life, and for the welfare of the society, he is committing suicide. That means it is altruistic suicide. So that is regarding decision based suicide. Next one is disaster based suicide. Disaster based suicide is nothing but it is the disaster happening in that individual. Disaster can be external, man-made disaster, or it can be natural calamity. And of course, there are certain things that happen in that individual. He himself can consider that as a disaster in his life. For example, loss, death of loved one, grief, abnormal grief, failure, dowry system, financial problem. So all psychological problems are, this individual is taking all these psychological problems as a disaster in his life, and he react abnormally in that situation, and he can commit suicide. So it is another reason for suicide. So in nutshell, we can divide the reasons for suicide into 4 Ds. First one is disease based reasons, second one is drug based reasons, next one is decision based reasons, and last one is disaster based reasons. If you like this class, please comment below. Thank you.